Hi, my name is Nicole Kucine. I am a pediatric hematologist oncologist at Weill Cornell Medicine in New York City, and we are here at the 63rd annual ASH meeting. So it's always exciting to hear new data and new information about what people are working on. I will say as a pediatrician, a lot of the data here is clinical trials, which is a bit disappointing because they never involve children. And it's a real challenge figuring out the best way to get new drugs to kids. I think there's always the desire and the need to balance safety with not leaving kids out of clinical trials. And I think because MPNs are so rare in kids, figuring out the right way to do a study where you get good data and can actually use it is really tricky. So I think there's a lot of challenges to doing clinical trials in kids with MPNs. But I'm hoping that with collaborative groups like the Children's Oncology Group and advocacy organizations and colleagues at other centers, that we can put our heads together and figure out ways to do it. I think some of the other stuff that's really exciting at ASH this year is people thinking outside the box and different ways to look at risk and prognosis. There was some data presented on looking at MPN fitness and seeing how that predicts risk. There was data looking at a model made of age and neutrophil and lymphocyte count, which are two different types of white blood cells, and putting that all together as risk models. And I just think that's really neat and interesting. And we have so many risk prediction models, and to really think about something different and to look for other ways to study risk and benefit for patients, because that way you can counsel people better on what you really think their risk of prognosis is. There was unfortunately not really any pediatric data this year at ASH, and that happens again because they're rare, and so I'm working on some projects now, and I'll hopefully get some stuff together for ASH next year. But there is a poster tonight that I'm looking forward to seeing that is a study of a group of adolescent and young adult patients, so comparing them to some older cohorts and looking at rates of thrombosis and disease progression and survival. And it seems like the data is very positive for these young patients and that they do have better rates of survival, which is what we expect to see and want to see for our youngest patients. So I'll be looking forward to seeing that poster tonight.